Hello and welcome to the Headache Doctor podcast, where on this podcast, it is our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'm Dr. Taves, your host, and in this podcast, we're going to talk about why having a plan matters. So recently, news in my life, we had our fourth kiddo. His name's Sullivan, and he is incredibly cute and awesome, and it is so fun having another little baby in the house, even with all of the busyness and interrupted sleep and everything that goes with that. And my wife is a rock star in being a mom, and so she makes it a lot easier on me. And so anyways, big news for us. One thing that, the reason I'm saying that is one, because when I haven't hopped on the podcast in a couple of weeks, and so stepping back in after being away, and I'm excited to get back into it because I'm very passionate about obviously helping people with headaches and migraines, and I'm glad you are here. The other reason I'm talking about it is because when I was coming up with an outline for this podcast, or a topic at least, I was thinking through a scenario we had earlier this week. Actually, we're still going through it. But our youngest, our newborn, had to be admitted into the hospital, and by the grace of God, he's going to be okay, and things are good. But what I wanted to do is talk about why a plan is so important. And when we interact with providers in our healthcare system, why oftentimes working with providers that ask the question why, and then can give a very clear, here's the direction we're heading. And it doesn't need to be this rock solid guarantee plan, but it just needs to be an educated, based on experience, here's my parameters, here's where we're going, and here's why it's going to help, okay? And oftentimes in our healthcare system, we don't really get that. So in my scenario, the past few days, I am interacting with providers, different types of providers that are coming in and out of the hospital room. And it started in the emergency department, and then we went into then we got admitted into the hospital, okay? And with every provider, I'm trying to get to the why, and then the what, and how. And so I'm trying to understand what is actually there based on their experience, what they think is happening, and where we're going. And one of the things that's remarkable in our healthcare system is oftentimes providers don't want to go into this. They don't want to, in a sense, stick their neck out because they perceive liability in the sense of like, I don't want to say something that could be wrong, right? Like I don't want to be incorrect. And if we take that sort of mentality and we zoom out and we say, okay, like if we apply that rationale of like, I don't want to assume anything until I'm 100% sure, oftentimes in what we see in our healthcare system. Now, in the scenario of like emergency department and there's something that's actually life-threatening, there's good reasons to just like, CYA. Basically, you're going to do all the tests and all the interventions and all the things to make sure you don't miss something. And that's kind of what happened in our situation. But when we don't have those life-threatening scenarios, then we need to and really in either case, we need to start thinking about what is the most logical conclusion of what's happening, and then put a plan in place that's reasonable and points someone in the direction of improving their health. And we don't necessarily need to be 100% rock solid, this is guaranteed to work, because life isn't that way. We're so nuanced in our experiences, the things that we introduce our bodies to, whether that's physical stress, emotional stress, physiological stress, whether that's stress to our gut health, our diet. There's all these different variables that come to play. But if we can find providers that will think based on their experience, their education, and help us answer the question why, and then put a specific plan in place so that we know now we're equipped as individuals with this problem, with an understanding of what the most likely scenario is, and then it empowers us to move forward in a direction where we can advocate for ourselves, or in my situation, my son, And then it's like, okay, now we're on a team. You basically allow the patient to step onto your side of the playing field instead of this sort of power dynamic where like, I'm the authority, you need to listen, and you enter into a conversation. And so it's that conversation that some providers were more willing and even some like volunteered. I mean, they're sitting down and they're saying, hey, here's my rationale. Here's what I think. Here's why we're doing this. Here's why we're doing that. And it becomes a conversation. But I would say maybe I would say the majority, or more commonly, we have to try to pull that out of providers. And I think one thing that I can speak confidently to in the headache and migraine space, since that's what I do all day, every day for the past 10 plus years, is the headache and migraine sufferers, so you listening to this podcast, have very likely not, you have not had a provider sit down and just go through rationale. Why? Why is this happening? How do I use my education? How do I use my understanding of anatomy, physiology, of how the brain works, of how we perceive pain, of where the pain could be coming from? And how do we understand what's happening to put a plan in place that uses those different variables so that the key here, and I say this on the podcast, and you've probably heard me say it, but time on your side, okay? Now, that brings me to the last sort of analogy with what's happening with my son currently is when we started, it was, okay, this is something that's serious and we need to take care of it because time seems to be against him right now. So time is not in his favor, so we have to act quickly. We have to do the things to shift the direction or the trajectory of what's happening right now, okay? And then, and this happened just earlier today, actually, then when we feel confident that we understand what's happening, and then we can put a plan in place, and that plan puts time on our side, then we can feel confident, not that the pain or the symptoms go away immediately, and they may even like take a longer period of time for all these things to recalibrate, but ultimately we understand how to improve our health, and specifically in the scenario of what's happening to us that led us to this point, right? So for you listening to this, what that means is what we need to do is look at your scenario of head pain, facial pain, whether it's dizziness, nausea, whether you have an aura, visual disturbance, whatever it is, whatever your presentation is, we need to look at it. We need to understand it in the context of how the body works, anatomy, physiology, and then we need to understand the biomechanics, where the pain could be coming from, and we need to put that in the context of people that we've helped in your that are like you, and what does the trajectory look like? And then we take all of that information and we put it into the framework. And the framework that I'm talking about that we've come up with after years of doing this is the 3-spoke model that we use to evaluate and then take someone through our process. And just for those of you that maybe are unfamiliar with it, it's going to keep coming up a lot on the podcast because I think it's a key component of helping you guys understand how to, like, the plan is the 3-spoke framework. And the first component is understanding the source of pain, which is likely neck, jaw, shoulders. The second component is breaking down any barriers that your body might have to respond to the treatment that actually addresses the source of pain. So in that barrier category, one of the things we see is like small airway, inability to breathe through your nose, sleep being an issue. Maybe it's like hypermobility throughout the body, Ehlers-Danlos, EDS. Maybe you've developed POTS, things like that. And then the third category is the systemic side. So systemic meaning the whole body, your general health. How good is your general health? Because that impacts your threshold for tolerating pain. Okay? So that's the framework. Those are the things that we don't question, right? Like we don't question that like pain comes from somewhere. We don't question that there could be barriers for you improving. And we don't question that your general health needs to be considered, okay? So it's sort of, those are the foundational pillars of what we're trying to do here. And when we think about that those things transferring into most other scenarios within our healthcare system, most other issues that people deal with, it's probably going to hold up to that stress test, right? Like put it in other scenarios and think, okay, where is the problem actually coming from? Like the source of it. Like I don't want to just mask this with medication. I want to understand what's happening here. And then we want to understand what are barriers that would prevent the treatment approach from actually working, or maybe there's barriers that are going to keep me in this cycle if we don't understand what those are. And then the third is, what's my general health? Because if my general health is all out of whack, the thing going away is going to be a lot harder because my body's going to have a hard time. Since the threshold's so low, I'm just going to be stuck in this pain cycle, right? So all three need to be considered. And so when we zoom out and look at our healthcare system in the United States, and I think this is true for a lot of the developed world. So whether that's Europe, Canada, most of the countries that we interact with, sometimes Australia, I would say that the people that we interact with, the healthcare system is similar to this in that we are sort of looking at these things in isolation. And then I would say our healthcare system in general is sort of not even asking any of those three pillars. They're not necessarily addressing any of them because medication is sort of this thing on the side that just takes whatever symptoms you're experiencing and like tries to shut them off. Okay. So again, that's like a general sense. And when I'm thinking about the process we've been through the past few days, it's super helpful to talk with a provider and just get a plan in place. And so that happened today. And I felt freed up. My wife felt freed up. Like the room just changed. The sense of like what is actually happening and where are we going, that pressure was stressful and it was concerning. And then as soon as we were all on the same page, we had the test results, we had sort of the rationale, we understood where maybe this came from, and then we're like moving towards a direction and we're seeing some progress, then everything in the room changed. Now, what didn't happen is it's not as if my son's condition like changed dramatically within that moment. It actually didn't, and it's going to be a process over the next week or so to see it resolve completely. But ultimately, what happened was we had direction, and I've worked with people before that in one conversation, when we can break these things down, give them a sense of understanding, and then point them and empower them in a direction that makes sense, it's like that is the moment where they realize they can actually heal. And that is the moment that had so much value for my wife and I just today, like in real time as I'm recording this. And it's profound because that sense of loss of control, and maybe this is just me as a business owner or whatever, like I have to, that's something in me that, and in everyone, like we want that sense of control, right? And so when we feel out of control, the problem is way worse. The condition of my son didn't necessarily change dramatically, or it didn't change at all within that conversation, but if you test like physiologically, like my heart rate or stress level or things like that, like from before the conversation to after the conversation, like here's the test result and here's where we're going. It was like, oh, like I can take a deep breath because now I know, right? So why am I saying all this? I'm saying all this because here at Novera Headache Center, that is something we've realized is incredibly valuable to you because you need a plan in order to understand how to get out of this situation. And that plan is something that we want to emphasize as opposed to just saying like, hey, we are this unique, super special set of providers and like you have to just lean into us and our super cool skill sets. We want to empower you. And so what we've done more recently is set up our process so that any new individual, any new coaching client or patient that works with us, we're going to have a more robust intake process. And then we're going to provide this plan based on our 3-spoke framework. And that plan is something that we're going to work through with you. Again, whether it's virtual coaching or maybe you're traveling to see us, and that first week we're going to put a plan in place and then make sure that you understand what that looks like. And because when you're traveling to us, some people, they leave feeling better. Some people leave not feeling better. Some people, it's like, okay, their system was so ramped up that it needs some time to cool off. But the plan and working the plan, sticking with this process is what we've seen shift from time against you to time on your side. And so when we have people that are bought in, they understand, and they say, yes, I get how this makes sense. I get where we're going and that direction. That's what we're trying to hit on, because these are hard problems to solve. And the way we solve hard problems is we work with things that are real and objective and that we know are going to be true and helpful to you. And then we lean into those things, and it's that shift from time against us to time on our side. And it's not this power, what's the word I'm looking for? Essentially, like, we don't want to be looked at as the authority in the sense of like, we're just going to tell you what to do in our traditional healthcare setting, where don't ask questions, don't ask why. We want to educate you with, here's our model, here's how you fit into it, and here's the steps you can take to feel empowered to make these changes. So here at Novera Headache Center, we have our 3-spoke framework, and we have a plan that every new patient is going to get, whether you are traveling to see us. And we currently have our traveling patients come out to see us for at least 1 week, and we have a kind of a program set around that. We have our virtual coaching, and then we also have our in-person local Parker, Colorado Springs, or like South Denver folks. And we do have people that travel, an hour, 2 hours within the surrounding areas to come see us. And so what we're doing is trying to empower everyone we see through this model so that you too can have that shift, that moment of like, okay, I'm feeling more confident. Not that my symptoms automatically went away or like quickly or instantly went away. Obviously, we want that to happen as soon as possible. But we want to empower everyone we work with to understand how they can help themselves in their own health based on our experience, what we've seen, and then obviously what is true for our health. And so if that sounds like you, I want you to reach out to us. You can call 719-598-1010. You can go to our website and book a call with Eric, our onboarding specialist, and we would love to get started on this process with you. Please don't wait any longer. We love doing this work because we've seen it help so many people, and we would love to help you as well. In any regard, thank you so much for listening to the Headache Doctor podcast. As always, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.